Hello, my name is Dr. Punekar and this is PACES Station 4, Communication Skills and Ethics. The scenario we have today is the candidate is a doctor on the stroke unit. A patient who is 8 years old, whose name is Hope Smith, has deteriorated significantly following her admission with a stroke. There may or may not have been a drug error. The patient's daughter has come to speak to the ward doctor. I will read out the scenario now. The patient was admitted yesterday with a hemiparesis due to a large cerebral infarct, confirmed on a CT brain scan. She has deteriorated further and is now very drowsy. Having been awake and orientated on admission. The staff nurse on the ward has explained to the patient's daughter that her mother has deteriorated. The nurse also mentioned that the patient had been given aspirin after a CT scan of the brain confirmed a cerebral infarct. The patient's daughter is very upset about her mother's condition. She wants to know why her mother has deteriorated and what can be done now. She's also upset that her mother was given aspirin. She had informed the ward staff that the patient has had a major gastrointestinal bleed 4 years ago due to aspirin. There is no history of aspirin allergy recorded in the patient's notes. The patient has been taking omeprazole regularly. The task of the candidate today is to explain to the patient's daughter what has happened, provide details of her mother's condition and the deterioration and the management plan. The candidate should also answer any questions that the daughter may have. Hello, Dr. Dham.
Hello.
My name is Dr. Punekar. I'm your examiner today, and this is Station 4, Communication Skills and Ethics. Please come. Take a seat. Okay, you get 14 minutes with the relative and then a minute to collect your thoughts, followed by 5 minutes of discussion with the examiner. Okay, so please start.
Hello. Are you Mrs. Smith's daughter?
I am, yes.
May I ask your name, please?
My name's Laura.
Hello, Laura. I'm Dr. Dar. I'm one of the stroke doctors. Thank you for coming today to speak to me. Can I ask you, what do you know so far about your mom?
Well, she was fine yesterday. Just a normal day. And then she said to me that she'd noticed she'd gone weak. Still fine. You know, you see the advert, so I brought her to the hospital. And she's had a stroke. So that's yesterday, really.
It must be very difficult for you.
Yesterday wasn't difficult. My concern is today she is not right. Okay? Yesterday, when I brought her in, yes, she was weak, but she was talking, she was fine, she was conscious. Now today, she's just... And you know what? I think I know what it is. That nurse told me that she's been given aspirin. Now my mum is allergic to aspirin.
Right. And when you said allergic, what did she
She had a
have?
horrible... It's about 4 years ago now. And she'd... So I don't know why they gave it her, but she had aspirin for something. And it was awful. She would become really unwell. She was in hospital for about 2 weeks. She had to have all these cameras down her throat and all sorts of things, and the aspirin had been the thing that made her bleed. And then now I bring her into the hospital and she's given aspirin again. Is it not bad enough that she's got a stroke, but then, you know, on top of that, these stupid incompetent doctors go ahead and give her aspirin? Now she's got two problems. Now she's going to end up bleeding. It wouldn't surprise me if the reason that she's not talking today is because she's had a bleed overnight. It's just disgusting. I don't know how, you know, you doctors, you're supposed to know these things. You're supposed to be aware of allergies and appropriately respond to the allergies. I just think it's disgusting, to be honest.
I can understand why you can be upset, but let me explain. So when your mother came to the hospital, she had a big stroke affecting the right side of her body, and it is quite common practice, it's a standard practice to give somebody aspirin as part of the treatment.
But not if I'm allergic to it.
Well,
Surely not.
Let me explain. So when we look at her notes, there was no mentioning that she is allergic to aspirin.
Yeah, but I told them. I said, when we got here, they said, any allergies? I said, yeah, but aspirin, she's allergic to aspirin.
Right. So when we went back to her notes, it said that she had a bleed because of aspirin. Now, aspirin can cause bleed from the stomach or gut, but it's not an allergy as such. And we gave her something to protect her stomach. So in that case, the bleeding because of aspirin is quite unlikely. And at the moment, there is no signs that she is bleeding either externally or internally.
How do you know?
So nobody has noted any blood coming out from her back passage, or when we checked her bloods, there was no suggestions that she is bleeding internally. So I don't think it was an aspirin allergy. Now, the fact that she is not as good as she was yesterday, I think...
She's not the same at all. She's awful. She won't, can't even wake her up.
Would you like a tissue paper, please?
She's going to be alright though, isn't she? Will she be okay? She'll be better.
We'll come to that. Would you like a glass of water?
Oh, it's fine.
Are you happy for me to start? Okay. So, we think that your mom had a very big stroke, and after a stroke, big stroke, initial few days are very critical, and the deterioration that you noticed is very much related to her stroke.
Okay.
But we're trying to rule out if there is any other possible causes of deterioration, such as a pneumonia, anything in the blood. So far, we couldn't find any other explanation. So it's very
Would
much...
she have got pneumonia from being in here? I knew I shouldn't have brought her in.
No, we did do an X-ray of her chest, which didn't show any pneumonia, and the blood inflammatory markers are normal as well.
Okay.
So this deterioration looks very much because of the stroke.
But people survive strokes all the time, don't they?
They do. It depends on a lot of factors, and one of the determinants of how somebody will do is how big or small the stroke is. In your mom's case, it's a very big stroke, so I'm afraid there would be a high risk of further deterioration, and there is real risk of dying
No.
or significant disability.
No, there must be something that you can do. Because before, honestly, you don't know my mum. Before yesterday, she was perfect. We'd go shopping together, she'd go to the pub and have a glass of wine. She was... I think you're seeing her as an 80-year-old lady who's not conscious, and that's not my mum. She's not a normal 80-year-old, she's fine. And I think you can do... There must be something you can do. There must be.
Well, we are doing everything possible at this stage, but given the fact that it's a very big stroke and she is deteriorating without any other explanation, it is quite likely that her stroke has worsened and there is significant risk of deterioration.
I'm gonna have to
I can
ring my
understand how
brother.
difficult it is for you.
She's the only one I've got. Oh gosh. Can you,
Do you have any family members?
yeah. I've got two brothers. One of them doesn't live far away, but one of them's in Australia. What I want to do? Does he have to come?
Did you manage to speak to...
I wanted to wait to talk to you. I didn't want to worry him. She was fine yesterday. Gosh.
As I said before, that the initial few days after a stroke is very critical when the brain can swell around the stroke sites. And there is a significant risk that your mom can even deteriorate further. So I think your brother should be informed that how critical the situation, and if he wishes, he should come.
How long?
Unfortunately, I don't have any crystal ball to accurately say how long, but next few hours to few days would be very, very critical.
Oh my gosh. Okay. So the aspirin, it's not the cause.
No, it's not the cause.
You've stopped it now though, just in case, haven't you?
No, we're still continuing with aspirin.
Oh my gosh, you can't. But she's not bleeding now. Surely you've had a lucky escape and you need to stop the aspirin, because if she starts bleeding then she's got no chance. Because I remember last time when we brought her in and they said it was a major hemorrhage and red blood cells, they'd gone down and everything, and they said it was very hit and miss whether she'd be alright, and they had to transfuse her. Now, she's had a stroke, she's this bad as it is. If you go and give her more aspirin, she's going to deteriorate even more.
First of all, if we weigh up the risk and benefits of giving aspirin, in this case, it is slightly more beneficial to give aspirin, and she's
Not
not.
if she bleeds.
She's
bleed.
not currently bleeding, as I said. There is no external or internal signs that she is bleeding, and aspirin would be beneficial, and we have given something to protect her stomach so that she doesn't bleed.
Can I talk to another doctor?
Yes, absolutely. So what I will do, I will ask one of my nursing colleagues to come sit down with you and have a chat, and I will show you the CT scan of her brain, which might give you an idea that how big the stroke was, if this is something you want to see.
I want to see it, please.
Absolutely. We're not hiding anything, so I'm very happy for you to speak to my nursing colleagues, and I can also arrange an appointment for you to see my consultant if there's something you want.
But she could get better, couldn't she? Like, there's a chance.
There is a small chance, but the possibility is that she will deteriorate, and that risk is significant.
Okay. Can I go and see her?
Of course, so if you could just sit down here, I will ask one of my nursing colleagues to come, okay, and then you can spend time with your mom. Is there anything else you would like to know?
Thank you. No, it's fine.
I'm sorry about the situation.
Thank you. I'm sorry.
That's okay. Thank you.
Okay, have you finished?
Yes.
Okay, thank you. You get a minute now to consolidate your thoughts, and then we'll have a 5-minute discussion. Okay, so Dr. Dart, tell me, what do you think made the daughter react in this way to her mother's deterioration?
there might be a few reasons why she was reacting that way. One obvious explanation would be non-acceptance of the fact that her mom is so poorly and could potentially die. And it's quite a normal bereavement reaction that initially patients or relatives might be non-accepting to the reality, or they're in denial. And also the fact that she hasn't got any other family members and the brother is away and the mother can die without getting the chance to see him again. So those are the things I think played an important part in the way she was reacting. And another issue might be that she really believed that it was a true case of error from our side where we mistakenly prescribed aspirin, knowing that she was allergic to aspirin, which was not really the case, and I explained it to her that it was a side effect.
Okay. Well, let's just take that point. Say, for example, if she was actually allergic to aspirin, and the daughter had mentioned that to the ward, and still aspirin was prescribed and given, and the patient came to harm because of the aspirin prescription. If that was the case, what would you do?
So first of all, we got to accept the fact that we made a mistake, so I would apologize that that was a genuine error, and we will investigate it by doing a critical incident and look into why that had happened. But first of all, according to the duty of candor, we need to be...
Sorry, did you say duty of candor?
That's right, yes.
Good. Okay.
We got to be quite upfront and honest about our mistake and apologize.
Okay, good. Let's move on from that point. You said that the patient's daughter genuinely believed that the patient was allergic to aspirin. So, do you think you spent enough time with her explaining that this was not an allergy and a side effect?
I think I explained it, but the emotional state that she was in, probably she was not taking it all in, which is understandable. So I might need to explore this again with her. But I try to explain, and when somebody is very emotional, they might not accept all the facts that coming into them, so it might need readdressing. Okay,
let's just come to another point. The patient's daughter was very obviously concerned that a part of her family were far away in Australia. Would you advise the son to come, or what would your advice be?
At the end of the day, that would be her son's decision to come or not, what his wishes. But from a medical point of view, I would say that there is a significant risk that she can deteriorate, and there is a risk of death here. So if the son can come, that would be ideal, but it will depend from his side. But we can make a recommendation that
let's just move on now. What do you think were the ethical principles on play here? What ethical principles were guiding you in your discussion?
Yeah, there were a few ethical principles that played in this case. One was obviously principle of veracity or truthfulness, where I got to be honest that her mother's prognosis is very poor and there is a risk of death here. So I got to be honest and truthful about that. But having done that, there is another principle, is to do no harm. When I give all this information, she's already upset, and giving all this information make her more sad, or she can have psychological distress. So those were the two principles I think were in clash with each other.
Okay, good. Thank you.
Thank you.